right? Well, good afternoon. Reverend Nathan Mugalu, those are my names. I am a counseling psychologist by profession, as well as a public health specialist, and I am ED at Family Salvation Foundation, Uganda. I must report myself that in the morning I'm the one who sat with Charles, and we worked out a model which is actually here on paper on how we can impact the young people, especially on issues of child protection and safeguarding. Now, the concerns from my fellow religious leaders are actually about engagement, and I'm happy to report that in our consecutive engagements, we have agreed that we are going to work out a mechanism.
Progress.
And it change in our schools, and just one case can really be very dangerous. I know that doctor even understands the challenges around HIV testing, but even if it were possible, we would also openly do it. But what we do is to link up with facilities around us, because there's a guideline on HIV testing. Otherwise, the point was we only stick to what is acceptable in the school context. By the way, we also do pregnancy tests. That's how we find out that some girls are pregnant, and then we guide them accordingly. Now, finally, to my presentation, and as I get to my presentation, I want to also answer the question raised by Charles. If you are looking for people to engage, and you have your money, whom shouldn't you leave? I just want to confirm that Ministry of Education knows religious leaders must be among the first. Why? Because of the following. Number one, they are very knowledgeable. Many religious leaders have gone to school. Number two, they are updated. I see many of my Catholic priests really researching on everything that happens. So ask them about fistula, they know. Ask them about teenage pregnancy, they know. But some people assume that they only know spiritual matters. No, please. Many of them are actually professional doctors and nurses. If you go to Chibuli Hospital, you find there are so many Muslim clerics, some of them sheikhs, original doctors. Go to Rubaga Hospital, go to Mengo. Many of them religious, but also professional. So if you just want to leave them behind, you are doing yourself a disservice. They are versatile, they are available, they have a lot of time on them, they are approachable, they listen to everyone. Somebody say they are believed in, and many times those of us who follow them just know whatever they are saying is gospel truth, or it is Quran truth, if it is Sheikh saying it. So who is that one who doesn't want to work with them? They are great influencers. I hear these days we have media influencers. But you don't forget we have religious leaders as big influencers with big congregations. They are well structured. And this is something critical for people in this room. If you are looking for a structure that comes from up to the bottom, you can easily get it. I don't know where Islam starts from at the village level. Because my side there's a Kabondo, then you go to parish, then sub-parish, then all the way up to. There's leadership at all levels. Islam starts with a mosque, and then it goes all the way up to chief card and whoever it is. And of course they meet believers every day, and they talk to all types of people, and of course they mind their context. They don't simply say things. Wherever they are mindful of who is present. So ladies and gentlemen, for those reasons, for us at Education, we believe in them so much. When you go to research how many of our institutions are founded by the church, so many. How many are founded by Islam? So many. Therefore, even when we are drawing a curriculum or anything to do in school, we know that they are critical, they must contribute. Now to the discussion, which now has about 8 minutes because I've stolen all the others. They told me to present on guidelines on prevention and management of teenage pregnancy, which guidelines also double as the guidelines on re-entry. I know that I'm preaching to the converted because these guidelines have been around for some time. So in the introduction there, we are just reminding ourselves how the population of Uganda is and how many young people we have. And we are also reminding ourselves that many times these young people are in school. I don't know if many of you know how many days are in a term. The reverends, of course, know, and the sheikhs who are attached to schools. Originally it was, I think, 91 days. But are you aware we've added 2 weeks to catch up with lost time? So it is over 100 days in school, away from home. That means that as a school, we must do something around the health of our young people. The statistics are shown also on how the teenage pregnancies are flowing. But in the next slide, and I know that Margaret just didn't want to hand out these physical copies because she wanted you to listen to me. But to my religious leaders in here, everybody will go out with the guideline because this is the guideline. Me, I'm only making a quick summary about it. And in the quick summary, we are mentioning that they are based on 3 domains. These guidelines are based on 3 domains. The first domain is what we are calling the domain of impact, and here we are saying that before you castigate the teenage mother and refuse her to go to school and do all other things, and even call her a sinner because she went pregnant, this must also be in your mind that if you let teenage pregnancies continue just anyhow, fertility is also going to grow. The population is going to grow very fast if our mothers begin producing at that age. For example, if a mother started at 13 and is producing after every 2 years, by menopause, how many children will he have? Menopause is 40 plus. The doctors know more. But there are also health issues and nutrition issues if they simply produce anyhow. Remember the issues of producing prematures, and sometimes I talk some little medical language, but I copy the things from Dr. Justine. If you allow the teenagers to produce, then they produce prematures and all those issues follow. Education outcomes are affected when our young people get pregnant, of course, participation and decision making. Somebody has just said that when you are rich, you can speak and people even clap. But many times, if people also think you don't know, then they will not listen. So they can listen more if you have gone to school. That is one reason behind our thinking that even where this teenage girl, maybe had gotten into the wrong, as some people have said, let's give her a chance to come again, so that as she grows, she can be able to be part of those who can make decisions. But if you stopped in P2, what are you telling the village? If you stopped in senior 2 because you dropped out because of teenage pregnancy. Then we're also talking of the other impacts. Productivity and earnings and consumption is low when young people get pregnant and produce early. Public expenditure, I know the medical people in here and doctor over here knows the cost that government is putting on managing teenage mothers, but also on managing the adult mothers. So we really must have some concern here, the non-monetary and all the other. But of course, at the end of the day, there's perpetuation of poverty and inequality if teenage pregnancies continue. Now, all this falls in our background as we try to introduce the ideas as to why we had to organize the guidelines. And the question here is why the guidelines? The reasons are also very clear. Some people have already said, when these teenagers produce, they encounter a lot of ridicule and discrimination, discriminatory language. Out there, I don't know if you've heard what the villagers call these girls who have delivered. Mama wabana, Ofleya, Nalongo, even when they are not Nalongo. Some of them, when they go to school, they nickname them all sorts of names. There is lack of systematic approach by schools to teenage pregnancy. What has been happening once a pregnancy occurs? What has been happening? Go home. Even the way you go, nobody minds. But there's a psychosocial challenge, and I hear Reverend over there is a counseling psychologist. If this girl, in the eyes of the community, is a wrongdoer, and even in the hands of her very home, she's a wrongdoer, and you simply suspend her on assembly and tell her to go home, do you think she's getting back to the community? Do you even think she's getting home? She may decide to go and hide. She may decide to go and hang. She may actually decide to go and permanently get married, because instead of getting back home. So there are all these issues and there are contradictions on sexuality. Thank God the previous speakers have said a lot about this. As a country, this word sexuality has been giving us shivers, but also thank God we are slowly unlearning the shivers. I think people are even now beginning to mention it. As Minister of Education, what we were told to reject completely, even when we are trying to consult on the sexuality framework, was the C. However much the C will be defended by whoever wants to defend it, we say, okay, the starting point should be putting that aside so that we can understand what is the content in the remaining bit. And ladies and gentlemen, the content in the remaining bit is not very scary. It is almost the same as what we've been doing before. We know that we have been having PSF